Hi everyone. In pharmacy, if you refer any drug, so normally you will say as per IP, as per Indian Pharmacopoeia. So today we are going to discuss about what is this IP, what is Indian Pharmacopoeia, and what is the benefit we are going to get because of this Indian Pharmacopoeia. Okay, so apart from that, we are going to see various other countries' pharmacopoeia, international pharmacopoeia, etc. So before going to that, so let us know like how extent we know about this pharmacopoeia. Okay, so we are going to analyze our knowledge by using these questions. Question number 1, why modern drug list is not constant? So drugs are going to be added and deleted every year or every edition. So why it is? Question number 2, what is the implications of the publishing pharmacopoeia? What is the core idea of publishing this pharmacopoeia? Why different countries have their own pharmacopoeia? Question number 4, what is the need of international pharmacopoeia? Question number 5, why the pharmacopoeia is prepared under autonomous body? Then what is the need of studying pharmacopoeia of other countries? So this is Professor Manohar. Today we are going to discuss about the pharmacopoeia. So in this class we are going to cover about the importance of the pharmacopoeia, monographs, pharmacopoeial descriptions, then coming to different types of pharmacopoeia, Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia, European pharmacopoeia, then international pharmacopoeia, mercantile pharmacopoeia, and pharmaceutical index. So here we would like to know like what is the basic difference and importance of these international, mercantile, and pharmaceutical index. Pharmacopoeia is a legally binding collection of the standards and quality specifications for the medicines used in a country or a region. Pharmakon is drug, poiein is to make. So in Latin, pharmacopoein, it is termed as the drug, how to make the drug. The details of making drug will be there in the pharmacopoeia. The pharmacopoeia is a public tool, maintains the quality of the medicines by collecting the recommended procedures. So here normally in Indian scenario, there are so many types of treatments like Unani or Ayurveda, allopathy, homeopathy and all. So here this pharmacopoeia will give you the standards how to prepare certain type of medicine. So if you see in previous, so normally the people believe to babas and various unethical practice and unscientific practice to cure their disease. So obviously this particular scenario is not good for the science and even for the health of the individual. However, the pharmacopoeia is designed to study the effect of the drug in different category of the population. Here, for example, Caucasians, Negroes, Indian population and Chinese population. So these are going to be differ in their appearance, in their size, and even in their food habits. So that that ultimately affect the quality of the drug. So keeping view all this, here I mean to say the importance of pharmacopoeia. It furnishes the quality specification for active pharmaceutical ingredient to maintain the uniformity and control of the standards of the drug. So wherever you prepare the drug, it should have the same uniformity and same standards. It should have the complete information of the drug and their dosage forms. So pharmacopoeia can be used as a reference in various laboratory basically to test the content uniformity, the drug biological assay, everything can be done by keeping Indian Pharmacopoeia as a reference. And even in industry, what is the texture of the drug, what is the how the drug is going to appear, so what is the ingredients required to prepare the drug, what is the process, everything we can know from this Indian Pharmacopoeia. Coming to academic institutions, the drugs, its dosage form, its category, its mechanism of action. So all the information, contraindications, every information regarding a drug will be there in the Pharmacopoeia. So naturally is going to be helpful to avoid the adulterated and substandard drugs. So the Pharmacopoeia basically contains the list of drugs and other related substances, the source of the drugs, the description, whether it is a white, brown or grey, which color it is, what is the texture, so taste, the formula, uses, dosage and storage conditions, etc. So monograph. Monograph is a detailed written study of a single specialized subject or an aspect of drug. In this case, we'll have a complete information regarding a particular drug, right from the source to essay. Coming to significance of the monograph, it provides a reliable base for the judging the quality of the drug substance. It way to control the adulterated medicine. It sets standards for the quality, purity and strength. It concise the description of the single substance. It acts as a reference for the pharmaceutical drug specifications. So here normally the monograph is containing title, chemical formula, atomic and molecular weight, definition, statement of account, category, dosage, strength, description, solubility, test methods, identification, assay, limits, apparatus and reagents used, then reference substances, test animals, calculations and results, storage, labeling. Apart from all this information regarding a particular drug is called as monograph. So apart from pharmacopoeia consisting of the excipients, the mode of production, manufacturing procedure, everything regarding the drug will be there in the Pharmacopoeia. This is the picture of Indian Pharmacopoeia, which is published in 2018 with 4 volumes. So next we'll say like types of Pharmacopoeia. Pharmacopoeia requirements from a basis for establishing a quality requirement for the individual pharmaceutical preparations in the specific country. So here if you see the cultural and food habits are not same in different countries. So here the pharmacogenomic aspects are going to be differ, and the way the drug is going to be metabolized is also different from the country to country. So that is the reason. So every country has its own pharmacopoeia. Those countries of small, so which cannot afford the pharmacopoeia, they'll depend on the other pharmacopoeia. So proudly saying Indian Pharmacopoeia, it has its own set of standards to prepare the medication. So apart from Indian Pharmacopoeia, we have US, European, British, Japanese Pharmacopoeia. So here the father of Indian Pharmacopoeia, Ramnath Chopra. Sir. So Indian Pharmacopoeia Commission is an autonomous institution of the institution which work under the Ministry of Health and Family Welfare, which sets the standards for all drugs that are manufactured, sold, consumed in India. A set of standards are published under the title Indian Pharmacopoeia. So Indian Pharmacopoeia list was published in 1946. Here you need to see that it is the only list, because in those days there is several categories, several systems of the medication is going to be there, right from the Ayurveda, allopathy, Unani, all these things. So from all this category of the system and different systems of the medication, so this Ramnath Chopra sir, he's identified specific medications from each system and he prepared a list of drugs. So that is called as Indian Pharmacopoeia list, which is published in 1946. Make sure this is not the Pharmacopoeia, this is only the Indian Pharmacopoeia list. But the first edition of the Indian Pharmacopoeia was published in 1955 under chairmanship of Dr. B.N. Ghosh. So here the different editions of Indian Pharmacopoeia. The first edition is 1955 with one volume, and the edition or supplements are published in 1960. The second edition, after almost 11 years, 1966, the second edition is published, and amendments added after almost 10 years, 1975. So here I mean to say this is the time taken to develop various monographs of each and every drug. Coming to third edition, so we can it is published in 1985 with volume 1 and 2. Here I mean to say the description and the details and number of the drugs are increased. That is the reason in 1985 they published in 2 volumes, and supplements are added 1989 and 1991. Coming to fourth edition, published in 1996, and fifth edition 2007. So with 3 volumes of the IP. So here we can see the growth and development of pharma sector in India. So in 7th edition in 2004 we come up with 4 volumes, and supplements added in 2015 and 16. Next, 8th edition is published in 2018 with 4 volumes. That indicates the growth of the pharma sector in India. So then what is the need of studying pharmacopoeia of other countries? Yeah, so if the Indian pharmaceutical industry want to export drugs to other countries, it has to follow the standards of respective countries' pharmacopoeia. So if you want to supply to US, you have to follow US pharmacopoeia. If you want to supply to European countries, the pharmaceutical industry should follow the standards of European pharmacopoeia to supply the medication to those countries. So British pharmacopoeia. So previously Indian we used to follow this British pharmacopoeia before independence. It was published in 1864 in 2 parts. One is Materia Medica and Preparation and Compounds. In 2007, monographs are added, which includes the traditional Chinese medication. United States Pharmacopoeia. So here this is one of the oldest pharmacopoeia, which is start publishing from 1820, both in Latin and English language. So here from 1820 to 1942, so they used to publish this pharmacopoeia for every 10 years. Later on from 1940 to 2000, so there is a tremendous growth in pharma research and new medications are come up. So that is the reason every 5 years they used to publish the US pharmacopoeia. But from 2002 to till now they are publishing annually. That indicates there is a tremendous growth in the research of the new drugs in US. So coming to European pharmacopoeia, the countries which cannot afford to have its own pharmacopoeia, so a group of countries, they will form a union, and they will publish a particular standards. Those are called as European Pharmacopoeia. The first European Pharmacopoeia is published in 1964. These are the countries involved in this European Pharmacopoeia. So more than 35 countries together, they formed a particular pharmacopoeia called as European Pharmacopoeia. So then what is the need of international pharmacopoeia? Pharmacopoeia issued by the World Health Organization with the aim to achieve a wide global uniformity of quality specification for the selected pharmaceuticals, excipients and dosage forms. The information is collected via the consultative procedure, the monographs being established in an independent manner. So normally priority is given to medicines that are widely used throughout the world. The first international pharmacopoeia was published in 1951 in Latin, English and French. So especially pandemics like corona, so they need the same medication worldwide. So in that scenario, the international pharmacopoeia play a major role. Martindale pharmacopoeia or extra pharmacopoeia. So this is called extra because it has the explanation of each and every ingredient. So the Martindale is a reference book which contains most complete information on every type of drug in clinical use worldwide. This book was rich, especially with therapeutic and clinical information with explanation. It allows the pharmacist or doctor to determine alternative equivalent drugs that can be substituted. The Martindale Pharmacopoeia, first published in 1883 under the title Martindale, the Extra Pharmacopoeia. In June 2014, the 38th edition of the Martindale has been published, the Martindale, the Complete Drug Reference. So it is an encyclopedia of the chemicals, drugs and biologicals with over 10,000 monograph. It's a list of chemicals and their standards. It was published by the United States Pharmacopoeia, a pharmaceutical company, Merck & Co. from 1889. This is a private book which is published by a pharmaceutical company from US named as Merck & Co. So it provides a reference source on all aspects of pharmaceutical science and technology. So it will give more emphasis to the science and technology and its development, various chemicals and their standards, drugs, everything. Complete information will be there in this private book, so called as Pharmaceutical Index. Let us see the answers for the previous questions. Why the modern drug list is not constant? Because research is done in various aspects which yields n number of the new medication. So old drugs with various contraindications are removed and new drugs are going to be added every edition. Next, question number 2. What is the implication of publishing pharmacopoeia? So previously the pharmacy is used to be hidden or the hidden subject which all people not used to have the access. But right now, so by publishing, so everybody has the information, everybody has the access to the preparation of the medication. Next, why the different countries has their own pharmacopoeia? Because different countries has their own genetic makeup and their food habits and their environments. Depending on that, they can create or they can tailor their own medication. What is the need of international pharmacopoeia? So this is particularly to fight against various pandemics that is threaten humankind. Next, why pharmacopoeia is prepared under autonomous body? Because the pharmacopoeia involves some lakhs and crores of dollars. So here any company or any individual cannot influence on the list or the medication procedure. So that is the reason why the autonomous body will take care of the pharmacopoeia. Next, what is the need of studying pharmacopoeia of other countries? Yes, if your country want to supply the medication for the other country, so the pharmaceutical industry should follow the standards of the supplying country so that it can supplied and marketed over there. So that is the reason one should know the pharmacopoeia of other countries. Hope this video is useful. Thank you.